Hello, today I'm going to be doing your total hip pre-op informational session. I'm part of the physical therapy team here at Cary Medical Center, and we're just going to be discussing your upcoming hip surgery and what our role will be in all of that. So I kind of broke this whole surgery process up into three phases. The first phase would be before you come to the hospital. You'll want to declutter your home. This means picking up the throw rugs, removing any cords or wires, just so we have space for the walker to be moving throughout your home. It might be helpful to make some meals in advance, stock up on some food, some frozen or canned items, just so you don't have to cook when you go home after your surgery. You'll want to arrange for help from your friends or family. You won't be able to drive for a few weeks, so you'll need someone to drop you off at the hospital, pick you up, and bring you to your appointments. Um, if you have a second story in your home, you want to plan for a first floor setup if possible, just so you don't have to go up the stairs for the first week or two. It might be just be easier to sleep downstairs in a recliner or on the couch, or if you have an extra bedroom, that would be ideal. Um, we'll give you some exercises that you are good to start now. And it's very helpful to start now. It helps your muscles know what to do after your surgery. It increases your mind muscle connection, and it just helps you get ready for recovering after the surgery and knowing what to do. Another option that you have is pre physical therapy. Um, a lot of patients have been opting for this just because it helps them understand, what type of treatment they'll be getting after their surgery, what kind of exercises they'll be doing, and just helps their body get ready, strengthen you up a little bit, and get you ready for that surgery. Here are the exercises that I was talking about before. All of these exercises take place laying down on your back. These are the exercises that we'll do with you on that first day that we see you. So it's good to start them now so you know what to expect. The first one, you're just squeezing your butt muscles. You'll hold it for 2 seconds and then relax. The next one, you'll have a towel under your knee. It's not necessary, but if you need a little extra, reinforcement, you can use the towel. You're just going to push the back of your knee right into the bed or the surface that you're laying on, tightening up that quad muscle. The next one is you'll put a pillow or a blanket or a towel underneath your knee, and then you'll just straighten up that bottom part. Again, tightening up that quad, that upper thigh muscle. The next one is bringing your leg out to the side, kind of like a windshield wiper motion. You'll bring it out to the edge of the bed or the surface that you're laying on, and then bring it back to the middle. You can either lift it up a couple inches off the bed and then move it, or slide it across the surface or bed that you're laying on. The next one, you'll bend your opposite knee and then lift one leg straight up, tightening up that top thigh quad muscle as you do that. The last one, you're just going to slide your heel towards your butt and do a heel slide, trying to get as much bend in your knee as possible, and then putting your leg straight down again. All of these exercises can be done 1 to 2 times a day as tolerated. And again, those are good to start now before your surgery. So phase 2, while you're at the hospital. On the day of your surgery, you'll arrive at your designated time, which your surgeon will tell you. You'll want to make sure you bring comfortable clothing that is loose, you can fit around the bandages that you'll be comfy in. Make sure you leave all your valuables at home. Just bring the necessary things. When you wake up from surgery, the hospital staff will take your vitals. They'll get your pain medications on board. You might have oxygen in if you needed it during your surgery. You'll have an IV in, and you'll have a catheter in, and that's usually taken out the next morning. Physical therapy, we will see you that day or the following morning. So depending on what time you get out of surgery and you get on the floor with us, we wait 4 hours to see you. Those 4 hours, your nurses will be making sure your vitals are stable. Then they'll be incrementally sitting you up in your bed to make sure your blood pressure is good and all of that. After that 4 hours, we'll come in and see you. And then the next morning, occupational therapy will be in to see you. They'll help you get dressed, put your shoes on, shower, stuff like that. When we see you as physical therapists, we will get you sitting up on the edge of the bed. We'll stand up. We'll go for a walk, and we'll teach you how to use the stairs. And then when we come back, we'll lay in the bed and do those exercises that we were just explained before. So that's what it will look like on our end and occupational therapy's end. So next I have 2 videos of how to use your walker and how to navigate the stairs after your surgery. Today I'm going to show you how to use different assistive devices for getting around your home after your surgery, how to walk, and how to use the stairs. The first device I'm going to show you is the front wheel walker. This walker you might get after your surgery if you're not able to put all your weight through both of your legs. So let's just say I have my right leg operated on. When I begin to walk, I'll move the walker first. I won't move it too far. I'll keep it a good distance in front of me. I'll take a step with my operated leg and then a step with my good leg. And I'll repeat those. So walker, operated leg, good leg. Walker, operated, good leg. And that's how you're going to use the front wheel walker. So that was how to use the walker. And this next one will be how to use the stairs. So what I'll show you next is how to use the stairs after you've had surgery. So going up the stairs can be troublesome for a lot of people because they're afraid of falling. Totally understandable. It's best if you have a railing. If you don't have a railing on your stairs, you can use a friend, a family member, and hang on to their arm as you go up the stairs. The only device that you'll use going up the stairs is if you have crutches or if you have the cane. You won't want to use the walker going up the stairs. That will cause you to fall. So when you go up the stairs, you'll hang onto the railing or your loved one, and you're going to go up with the good leg. So I'm still pretending that my right leg was operated on. So I'm going to go up with my left, up with the good leg. Left first, then right. So up with the good, the weak leg follows. Up with the good, weak leg follows. Up with the good, and you continue that until you get to the top of where you need to go. On your way down, you're going to go down with the bad leg first. So down with the right leg first. So you step down. If you're having a lot of pain or you're worried, you can push through the railing to give you some support. So again, down with the bad first, then the strong leg. Down with the bad, then the strong. Down with the bad, then the strong. So that's how you're going to navigate the stairs. And that is the stairs video. So we'll go over all that again with you when you're in the hospital, but it's good to just see it now, get it in your head, and get a little expectation of what we're going to be doing with you. Today I'm going to show you how to use. So phase 3, when you're leaving the hospital and when you go home, you'll have home physical therapy. They'll come to your house a few times a week for about an hour. They'll do similar stuff that we do with you, the exercises, make sure your range of motion is good, and just make sure your home is set up so that it's the most optimal for you. Occupational therapy may come to your home if you need extra help with getting dressed, showering, stuff like that. You'll have your pain medication at home. You'll want to make sure you're staying on top of your pain medication schedule. So take it at the time you're supposed to take it. Even if you're feeling good, make sure you take it because you don't want that pain to pile up and then you're not in a good spot. You can use ice to help. You can use ice as often as you would like, for as much as you want throughout the day. So it's a good way to manage your pain. As far as showering, you won't be able to shower and get that bandage wet for the first 2 weeks. So you'll have to sponge bathe, and occupational therapy will help you with that. Making sure you're a little bit active throughout the day, getting up and walking, but you'll want to make sure you're not overdoing it. So don't do as much as you normally would, but don't sit on the couch all day and do nothing. So make sure you're getting up a few times a day and doing your exercises and just making sure you're staying on top of that. After 2 weeks, you'll have a follow up with the orthopedic office, and they'll take your bandage off and remove the staples, and then you'll be able to shower more regularly. And then you'll transition to outpatient physical therapy if your home physical therapist thinks that's something that you'll benefit from. So here are the hip precautions that you'll hear about over and over throughout this whole process. The first one is not turning your toes inwards. So your toes can face outwards and up to the middle, but not in. The second one is making sure you don't cross your legs. When you wake up from your surgery, you'll have a big purple like wedge between your legs. This will make sure you don't cross your legs. And the last one is making sure not to bend your hip past 90 degrees. So as you can see the image here, when the person bends over, they're breaking that precaution because that angle is getting too small. And then the next one, again, the chair is too low and he's sitting at an angle that breaks that precaution. So you'll just want to make sure you're cautious of this. And all of these precautions are set in place so that that hip doesn't dislocate. Those muscles are healing. You want to give them time to heal. The incision's healing. You want to make sure everything is healed before you do these types of motions. And then just some frequently asked questions. When can I drive? Typically, when you're no longer taking narcotics, you're safe to drive, which is usually about 3 or 4 weeks after your surgery. But again, it's good to check with the orthopedic office to ensure that you're good, that you're safe to drive. How long do you have to follow your precautions? 6 months to a year is a typical answer. It's just very important for those muscles to heal and become stable so they can protect that joint and make sure we don't dislocate or have any tears or anything like that. And then when can you stop using the walker? Usually when you're not walking with a limp, and your home physical therapist will help you transition from the walker to maybe a cane and then nothing at all. So they will help you with all of that. And that is all the information I have for you today on your total hip pre-op session. If you have any questions, you can contact us with those phone numbers that were at the beginning of the presentation. But thank you and have a great day.